Good afternoon and welcome to our Meet the Radiology Leaders Town Talk with Ochsner LSU Health. My name is David Trepanier. I'm a career outreach specialist and I will be facilitating today's discussion. With me are our radiology recruiter, Teresa DeLatin, our radiology leaders, Becky Longino and Cindy Reeves. And at this time, I'm going to go ahead and have everybody introduce themselves. Teresa, would you like to get us started?
Sure, David. My name is Teresa DeLatin. I'm the talent acquisition recruiter for the North Louisiana Ochsner LSU Health System. We have facilities in Monroe and Shreveport, and I have been with this facility for a little over 16 years. I love working for Ochsner, and since we became Ochsner LSU Health, it's been a wonderful change for us.
Great, Teresa, and excited for you to give some insight into the recruitment process today. Becky, would you like to introduce yourself now?
Sure, David. I'm Becky Longino, and I'm the interim manager here at St. Mary's Medical Center. I absolutely love St. Mary's. It is amazing what they've done to this hospital just in a short amount of time. We are the women's and children's facility for Ochsner's in North Louisiana, and I have been with the facility for 36 years.
Great, and excited to have you with us today, Becky. Now, Cindy, would you like to introduce yourself?
Sure, David. My name is Cindy Reeves, and I've been with this facility for over 30 years. I'm the diagnostic imaging supervisor at Ochsner LSU in the main hospital.
Thank you for that, Cindy. And before we get started, I'd just like to mention a little bit about the partnership Ochsner Health and LSU Health are in the North Louisiana region, where the organizations are partnered to bring the highest level of care possible to our patients in the entire state of Louisiana. So we're ready to get started here. So Becky, to get us started here, can you share why radiology at Ochsner LSU is a great place to work?
At St. Mary Medical Center, we have a beautiful facility here, both for inpatients and outpatients. We are the premier site for Women's and Children's Hospital here, but we also do a wide variety of different types of patients.
You have a lot of learning opportunities. You have a chance to really grow and develop in your field, seeing things that you won't see at other hospitals. We are a level 1 trauma center, a level 2 pediatric trauma center, a certified stroke center. We see a lot of critically injured and ill patients, and it's just a really great place to learn and grow and develop your skills.
And to continue, can we kind of discuss your different modalities? For those of us that have some knowledge of radiology, there's a lot of different areas and units and modalities and opportunities. How are your team structured, and how do those teams work together to support each other?
Okay, David. We have CT, MRI, ultrasound, breast imaging, bone density, diagnostic, fluoro portables, and rad rooms, and we also have surgery over here. So my team works together. We try to function as not 7 different sections, but one department of radiology. So it wouldn't be unusual for me to ask a breast imaging tech that wasn't doing anything to go help out in diagnostic, maybe transport some patients that day, or, process their imaging, something like that.
We have diagnostic imaging is the main modality. We have an ER x-ray, we have techs in the OR, we have techs in the clinic, and we have techs in the main department. So if there's a tech in the emergency room that needs assistance and needs a little help, we'll send a tech from the main department down to help them. And also with OR, a lot of times they do a lot of cases up in OR and they need an extra hand. So they just call down and we're happy to send someone up. Our techs get a lot of training in different areas. They can go from the ER to the OR to the clinic and be able to do it all.
Teresa, real quick, we keep hearing about St. Mary's and the main campus. Do you mind giving us a little insight into the different facilities in the Ochsner LSU Health Network?
We've grown significantly since we became Ochsner LSU Health. We have the main hospital here in Shreveport on Kings Highway. We have our newest facility, St. Mary's Medical Center, which is located on Margaret Place, also in Shreveport. We have our Monroe Hospital, our main hospital in Monroe. We also have so many clinics throughout the community here in the Shreveport and Monroe areas. We have urgent cares open in Shreveport and Bossier in the North Louisiana area.
Becky, do you think you could give us a little insight into the training on your modalities and what does that process look like?
Sure. The first 2.5 days, my staff always report to Cindy at the main campus for their orientation. And then once she's finished with them, they come over to St. Mary's. We introduce them to the team, take them on a tour, and then we start their competencies here. Everyone has to perform room competencies and patient competencies on patients. And normally their orientation period would last around 6 to 8 weeks. We do, however, have some staff that it takes a little longer. Either they've never been to the facility before, or they're just new to their modality, and so it would take a little bit longer for them to train.
With us usually takes about 6 to 8 weeks. The techs will report to the main department and I will work with them hands-on for their first week. I get them set up on all their online learning modules. I go over all the policy and procedures and department procedures with them, and I basically teach them everything that they need to know to do their jobs. And then I start them in their various rotations. I usually will start them 2 weeks in the OR, and then once they complete that, perform their competencies up there, then I'll move them to the ER for 2 weeks, and then they'll come back to the main department. And then if they feel like there's an area that they need a little more help in, I'm happy to rotate them back through those areas, and they complete all their competencies and check-offs before we start them on their shift.
And if somebody isn't really sure at the end of their training period, can they continue the training period? What does that look like?
A little more help, then I will find out what areas that they need to improve on, and I'll rotate them back into that area until they feel comfortable.
And now transitioning to a different aspect, you think you could give a little insight into your patient population and what does that look like?
Sure, David. I said that we were a women's and children's hospital, and we are. But we have every type of patient here that you would experience at any other type of hospital, except for the fact that we do not do trauma or the burn center here. But as far as geriatrics and pediatrics and, male, female population, we have all the normal or the regular type patients that you could account for.
From all walks of life and various injuries and illnesses. We do have a burn unit. It's the only one in the Arklatex. We do have also an on-site morgue, and we see a lot of critically injured trauma patients.
Becky, can you share why your modalities are a great place to start a radiology career?
David, whether you're starting a new career as a brand new graduate, or if you've been in a field for 10, 15 years and you want to try something new, it's a great place to come to St. Mary's Medical Center or Ochsner LSU, just for the simple fact we're teaching constantly. This is a teaching facility. We teach radiology students, we teach residents and fellows. So this is a great way to start a new career or advance a career that you've already been involved in.
Cindy, as a hiring manager, someone that interviews and interacts with candidates a lot, do you mind sharing some of the personality characteristics that you look for in someone that are indicative of a successful radiology career?
Caring and compassionate, someone that will put our patients first, an applicant that will just really exhibit our core values that we have at the hospital. Patient care always comes first. Someone who is dependable, someone who can work well as a team, but also be able to work independently. and someone who shows up for work on time and with energy and is ready to work with others. And like Becky stated, we do work with a lot of students. So someone who doesn't mind teaching and training the next generation of radiologic technologists.
Now, kind of looking at from a career perspective, what are some of the cross-training opportunities for rad techs?
I'm glad you asked, David, because over at St. Mary's, I have several of my staff cross-training. I have a mammographer that's already double credentialed, and she's actually working on her triple credential for ultrasound right now. I also have a diagnostic tech that fresh out of school told me she wanted to learn MRI. So we have started her cross-training this week, and she's doing a great job. I also have two other technologists that are interested in cross-training in the CT department. So they have started that several months ago and will be sitting for their national boards very, very soon and for their second credential. So the cross-training opportunities are great, and it gives me more options with my staff at the same time. It's definitely a win-win for the staff technologists and for Ochners.
Great. And in those roles, the techs are gaining their certifications for those different areas, those different cross-training areas, correct?
Correct. They're training, they're obtaining their numbers of exams that they need to sit for their boards. And we also have lots of education that we can share with the technologists to help provide them the education they need to pass those boards.
And Teresa, kind of to piggyback that a little bit, could you give us a little information on the tuition reimbursement for somebody that may be trying to go back to school or get a master's degree while working for Ochsner LSU?
Yes, David. Our tuition assistance program is available to all employees, and they are eligible to apply for this program after they are with us for 1 year. It pays a maximum of $3,000 per year and a maximum benefit of $12,000, which is a great opportunity for all of our employees that are interested in, continuing their education. And Ochsner has always, since day one, promoted the further advancement and education of all of our employees.
And now, Cindy, considering the system's response to the COVID-19 pandemic and that Ochsner Health and Ochsner LSU Health have treated the majority of COVID patients in the state of Louisiana, what has been your team's response to the pandemic?
Ability in our system has, number one, provided a safe environment for patients as well as staff. Everyone abides by the mask wearing policy. Every employee does everything that they can to make sure that there's a safe environment. We wear our protective equipment, our mask, our face shields, our gowns, our gloves whenever needed. The system has been very good about communicating with the staff via email, leadership meetings, keeping us apprised of the different changes and things that are going on with COVID. As we all know, it changes on a daily basis sometimes. There's temperature check stations for patients and staff. Everyone gets their temperature checked, hand sanitizer. If you don't have a mask, we're happy to give you a mask. And our hospital's been very good about supplying this PPE for all the staff. We've not once run out of any supplies that are needed to take care of our patients.
So this one, what are some of the pieces of advice that you may have for someone that is nervous about the transition from school to the real world?
I think that my advice would be don't be afraid. Jump right in, because we're used to dealing with students and teaching. There's no silly questions. I've been in this field a long time. Actually, maybe I should say there are silly questions, but I've heard them all. So, if you're interested in a career here with Ochsner, give us a call and let us answer your questions. I'm happy to talk to applicants at any point in time.
Okay, and Cindy, do you mind?
Sure. My advice to new graduates hired on here would be to be flexible, be open to learning, because you, like Becky said, you're going to learn so much more your first year of working here than you ever did in school. And don't try to take it in all at once. It's maybe too much. Just kind of take it step by step so it's not so overwhelming.
Great. Thanks, Cindy. And Teresa, for the last question here before we get into our questions from the live stream, what are some of the tips that you would have for someone that's ready to apply to Ochsner LSU? Where can candidates find the resources they're looking for? Where could somebody apply?
Thank you, David. That's a great question. The first thing any applicant will need to do is go to our website to submit their application and upload their resume. Our website is OchsnerLSUHS.org. That is OchsnerLSUHS.org. The first step is building a profile. Once you build that profile, you can search all of our opportunities for those positions you're interested in, especially for our radiology group. You will be able to see all of our positions posted there. These positions include the entire job description, as well as minimum qualifications, which include experience, certifications, those kinds of things. While you're submitting your application and uploading your resume, there are a couple of things that you need to make sure that are correct. We have a lot of electronic transmission of communication and virtual interviews and those kinds of things. So it's very important that this information be correct. Your email address, make sure you have a personal, professional email address listed in your application and your resume. Make sure that your phone number is a correct and working phone number, and that your voicemail is set up, that your mailbox is not full, and that we are able to reach you when we get ready to interview you. And like I said, since a lot of this is electronic through our system, you may not see it in your inbox, so always check your junk mail or your spam if you don't find that communication. Once that happens, your application and resume are in a bank, and the hiring manager, which would be Cindy or Becky, would be able to view your application. And once they decide they want to interview, they would reach out to you. And sometimes that would be electronically, either through an email, or they may call you to set up that interview. They may do a Zoom meeting for the interview, or they may do a phone call. And it may be a panel interview, or it may be just a one-on-one. And there may be multiple interviews if that's needed in that situation. Once the interview is complete and the hiring manager makes their selection, they send the information over to us in HR, and one of our talent acquisition recruiters would process your offer. Then you would receive a phone call to extend that formal offer to you. And once you accept, and then we get that process started for you and get you started with a start date and your orientation, and get you on board as a full-time employee or part-time PRN employee with Ochsner LSU Health. I would ask all of our applicants to please be patient as we go through the applications, and it just sometimes takes a little time to be able to reach out to you. So, at least give us a couple of weeks. Some people put in an application and they expect an answer that day. But like I said, our managers are working managers, and they don't just sit in an office all day. They are out there with our patients, with our employees, and taking care and fulfilling our core values. I think that's it. We offer a lot of benefits to all of our employees. Standard medical, dental, vision, flexible spending accounts, retirement, 401k, paid time off, a whole lot more. Ochsner is just really employee centered, and they take their investment in their employees seriously.